Dr. Diamond here today. Today what we are going to be doing is helping this poor patient here who is suffering from what seems to be an extreme case of blackheads. Now, as you can see, some of them are here on the surface and many of them are actually underneath the surface. So here's one just like that, and they're just coming off some of them are pretty easy. Well, some of them are a little bit more hard to take off, just like that. See how that came off like that? So what we're gonna do is probably remove this first layer of the epidermis down to the dermis layer and see what we can do about extracting some of these blackheads. So let's go ahead and get started. I'm going to be taking our alcohol. As usual, we have to cleanse the area. Make sure that we are not going to be cross-contaminating. So I'm getting quite a generous amount of alcohol there. And let's go ahead and wipe down the patient. Alright. That looks pretty good. So what we're gonna do, I believe I'm going to just, let me shine my light here to see what we can see. Alright. You can see these little layers of, or I should say little specks of blood almost that are right underneath the skin. So I'm going to go ahead and take my 10-blade scalpel here, being careful to keep my fingers out of the way. We're going to, I'm trying to think of the best approach here for this patient. Alright, let's just go ahead and remove this layer in a triangular, or rectangular I should say, pattern. And we're not going to go too deep, but we are going to go deep enough to remove this so that we can see down in there. Okay. Alright, so it's still a little bit stuck here. I'm just trying to free that up. Okay, I think we got it. Alright, so there's that layer that I was talking about. And let's go ahead and look. Okay, yep. Do you see all of the blackheads that are in here? There's really just a bunch, so we're pretty much going fishing today, it looks like. So let's go ahead and get just a clean area to lay these on, these blackheads. I'm gonna go right here, and let's just begin. I'm gonna take that alcohol thing here and just dry this off. Oops. And we will remove what we can see. The problem is, it can be a little bit difficult to remove each and every single one of these because, well, there's so many. So a lot of times patients will go into dermatology offices complaining of issues like this, and they may need some medication, such as possibly doxycycline, which is like a antibiotic or steroid they use. A steroid, I should say, because that's what it is. And or some type of retin-A cream, which again is also used for acne. But when it's deeper like this, they may need something such as a steroid. And there's lots of other medications as well that can be used, but that's just depending on the patient's circumstance, age, any current health conditions. You have to take into account if a patient has high blood pressure, possibly some other types of chronic illnesses or diseases, because you have to be careful what medication you use then. And again, as you can tell, this is just a very tedious process to remove so many blackheads such as this. But sometimes, and I know this is happening in this patient's case here, they can be extremely not painful. Well, they can be, but what happens is they actually cause a lot of pressure under the skin sometimes when they get big like this, and that can cause a lot of pain and discomfort for the patient. I'm just going to dry this area again. Good to keep it nice and dry, that way we can grip onto the blackheads a bit better. Okay. Let's see if we can squeeze any of these and pop it. No, not really. Maybe one. But it is difficult because they're so deep in the skin. They don't like to just pop out. Some of these ones that are a little bit looser, like that, come out a little bit better. Okay, so let's just keep going at it with these forceps. And again, this is a process that it's not that it's hard, just that it's time consuming, but very, very, very beneficial to the patient and to the patient's comfort. So that is why we do it. You can feel some that are really down in there that don't want to come out. And if you see some of these strings like this, that's some areas where the blackhead is stuck in kind of like a little sac, like the little root that it grows to. Sometimes those grow in like hair follicles and places like that, and they will not want to come out because they kind of hold on there. Oh, we lost that one. Oh, there we go. So they have to be cut out sometimes, just depends. These ones are coming out a little bit easier. They're not so bad. And then I think once we get all of this cleared here, we may need to remove another little layer so that we can see if there's anything else underneath there. And I'm assuming that there is going to be more. So we'll check and see. But yes, for my fellow colleagues and students who are in the observation deck, this is today's surgery. We're not doing any neurosurgery or heart transplants today. That will be soon. I have some scheduled. So as usual, just make sure you check the surgery board and you can see what's upcoming that you may want to tune into. It's always a pleasure to have you here. So here's some of those little kind of fibers, almost like collagen fibers they are, or maybe more like elastic fibers, because they do have a little bit of stretchiness, and they are the texture of elastic fibers. And if we looked at them underneath a microscope, I bet that's what we would be able to see. So we're just going to keep going. There you go, you can see some of those fibers there. But we are being careful, and the reason for that, the reason I'll just take a big scoop and just fling everything out, is because we don't want to damage any of the tissues or the nerve cells around these areas. So we're just being careful because we don't want to cause any scar tissue, or, like I said, any nerve damage, because we are digging around in a deeper layer. So we must be a little bit cautious of that. We have a nice pile going on there. And as I'm looking, oh wow, look at that big pile there. These ones feel a little bit tougher to get out than the others. Not too bad, but there we go. We can kind of pop some of them out. But what I am going to recommend for this patient is starting a steroid medication for just all of these blackheads and some other acne, such as just any surface acne that can be seen, which this patient does have, as we talked about right here. These are some. So it'll also help with that, which is a good thing. I think that even though this is quite tedious, it can be a little bit therapeutic as well, because it is kind of satisfying, if I do say so myself as the surgeon. You know, you see something full of little black lumps and bumps, and to remove them and see a clean surface area, I think is pretty satisfying. So here's some of that tissue. I'm trying not to remove too much of that because it's not damaged. So unless it's damaged and it's loose and hanging off, we're not going to take that out. We're just going to kind of let it hang out and work around it. And there's two blackheads in one little pit. So you'll notice that sometimes when I do pick these out, there are areas where the skin around those fibers will come out just like that. And that just means that they're a little bit loose or possibly damaged, so they are ready to come out. Like I said, just as a reminder, we are not going to be able to get every single last blackhead out because they're always just going to keep being produced. So even if we were able to remove them all, till that medication, well, till this patient starts the medication, the blackheads will keep being produced. So it's almost kind of like doing more work than what's needed or what's necessary for right now. But with that being said, this will provide some comfort because there won't be so much pressure under the skin. As long as you get the majority out. Let me take my light now. So we're looking pretty good. We have some there and possibly a couple back here in this corner. So what we're going to do is remove those, and then we will try to just go ahead and see how we did and close up for today. And that way, like I said, the patient will start the medication right away, and that will start treating these issues. Okay, I'm going to dry the area out because we are getting a little bit of excess fluid here. It's starting to get a little bit hard to grip the blackheads. So just drying it out. Nothing fancy. Oh, look, one came out just like that. Good. Now let's get these while we can see them before more fluid builds up. And what this fluid is just sebaceous gland excretions. So that's what causes sebaceous cysts and sebum, which comes out when you have acne or on your nose. And yeah, so that's what this is, just that buildup of extra fluid from that. Nothing too bad. It's no real cause for concern. It's okay. But because there is so much acne and blackheads, that's why this patient does have a little bit extra of that sebum. Right now I'm just picking in at what I can see, and once we think we got the majority, we can go ahead and close up. Like I said, no matter what we do, even as we're removing these now, we are going to just keep seeing them pop up. So there's only so much that we can do currently without the use of medication. I'm gonna put this piece of tissue back in because that was a little bit of a big chunk. I don't want to remove that much. There we go. Guess that's coming out. Alright, so I'm leaving the tissue as kind of flat as I can. See, I don't want to pick it out and mess it up too much. So we're going to leave it just like this. I think we did extract a good amount of blackheads here. As you can see, that is quite a large amount. So with that being said, I am going to close up. Let's go ahead and just dry the excess sebum and any other secretions. Okay. let's see how our tissue was on here. I think it's this way. Okay. And this is going to hold the tissue together. It is a kind of a different solution to using stitches because this will adhere to the skin and allow it to close together to re-heal on its own. I think we need maybe one more piece. So we like to do this when we can because then the patient doesn't have to come back for suture removal. Just a little bit beneficial for them. Alright, so there we go. And that will be all for them today. We will go ahead and get rid of all of this. Dispose of all of that. And as far as everything else goes, thank you very much for tuning into today's surgery. Like I said, there will be more upcoming surgeries. Check the surgery board and you can tune in. Thank you all for joining me today. I hope you have a great rest of your day and take care.